Today's question of the day says, the nurse has attended a staff education program about cystic fibrosis. Which of the following should the nurse recognize as a complication of cystic fibrosis? Select all that apply. So we know cystic fibrosis is caused by a genetic mutation that causes the secretions that are made normally by the body to become more viscous or like thicker, also called like hyperviscous, which can affect a lot of organ systems. So let's keep that in mind. Option 1, malnutrition. This one is a correct answer. It's a complication that's commonly associated with cystic fibrosis because those secretions that line the intestinal wall are abnormal. It affects the absorption of nutrients and then also the release of digestive fluids from like the pancreas and liver is also more difficult because of the thickened secretions. So they have more difficulty releasing digestive fluids and they have poor absorption. So this does lead to malnutrition. Option 2, osteoporosis. This kind of goes along the same vein as malnutrition. They have poor absorption of vitamin D, and then also through a couple other mechanisms, their bone density is decreased. So they do have difficulties with osteoporosis. Option 3, uterine fibroids. This one is actually not associated with cystic fibrosis. There are reproductive issues for men who have cystic fibrosis. There are changes in their anatomy that prevent sperm from actually getting to the semen. So they do produce sperm, but there's no sperm in the semen. So they do have issues with infertility. Option 4, diabetes mellitus. This one is a common complication for patients with cystic fibrosis. We know that those thickened secretions affect organ function in the body, and the pancreas is in particular affected. It affects the secretion of pancreatic enzymes, and it also causes dysfunction in the insulin production. So diabetes is very common in patients with cystic fibrosis. Option number 5, portal hypertension. Same idea here. The liver is affected by those thickened secretions, so they develop fibrosis of the liver tissue, and then in turn the blood has difficulty going through the liver, so then it backs up into the portal system and they get this increased pressure, portal hypertension, because of the fibrosis of the liver. So that one is also correct. So our correct options here are 1, 2, 4, and 5.
The nurse is teaching a client who has a new mechanical heart valve and is taking warfarin. Which of the following information should the nurse include? Select all that apply. So we are going to have more than one correct answer here. So let's look at our options. And option 1 says to request prophylactic antibiotics before any invasive dental procedure. So clients with mechanical heart valves are at risk for infective endocarditis, which is where bacteria can enter, and in this case, through the gums and whatnot when we're doing a dental procedure. You know, the mouth is gross. There's a lot of bacteria in there. So when we're in there poking around, bacteria can get into the bloodstream and land right on our fresh new mechanical heart valve, which would be so terrible. So we want to give antibiotics just to prevent that bacteria from getting and developing and spreading and all that where it shouldn't be. And we'll talk a little bit more about that with option 2. And so option 2 says to notify your healthcare provider if you develop flu-like symptoms. So these are going to be symptoms of infective endocarditis. Okay, bacteria where it shouldn't be, it's going to cause symptoms like fever, fatigue, chills. Another big thing with infective endocarditis are splinter hemorrhages, like in your nails. So you'll see those like red streaks. That's kind of a big red flag. We definitely want them to call the healthcare provider if they experience any of those symptoms. So that is going to be a correct option. Option 3 says to take naproxen to relieve minor aches and pains. We do not want to tell our clients to do this. Clients with mechanical heart valves are going to be, on warfarin, have that anticoagulation, and naproxen is going to increase the risk of bleeding there. So we don't want to do that with warfarin. We're already at really high risk for bleeding. So we want to minimize that. They could take like Tylenol or something like that instead. And then option 4 says to schedule routine monitoring of your INR. This is something we want to do on warfarin. We want to make sure we're at a therapeutic level. Blood isn't too thick, blood isn't too thin, kind of just right, so we don't develop any clots on that mechanical heart valve. Anytime we have something like mechanical in the heart like that, we're at increased risk for clots. The body just doesn't like it. It wants to go clot it off and stop it. So we need to tell the blood to calm itself down. Give it a little warfarin, make sure it's therapeutic and it'll be good to go. And then option 5 says to avoid using an electric razor to shave. We don't want to tell them to do this because we want them to use the electric razor. The electric razors are much safer than like a traditional blade razor where they could cut themselves. And again, our risk for bleeding is high with the warfarin, so we want to avoid that. But hopefully that helps, and we'll see you tomorrow.